So, let's talk about the word sociopath. We hear it thrown around all the time, right? In crime shows, on the news, maybe even describing someone's ex. But what does it actually mean? It's this really heavy label, but it's also super confusing. So in this explainer, we're going to cut through all that noise and get to what's really going on behind the name.
Yeah, you've definitely heard it. It's a powerful word. But what are we actually talking about here? Is it a real medical diagnosis that a doctor would give you, or is it something else? Let's figure it out.
All right, here's how we're going to break it all down. First, we'll dive right into the pop culture myth. Then we're going to clear up that whole sociopath versus psychopath confusion. After that, we'll get into the real clinical diagnosis, look at where it comes from, and finally, we'll talk about the tough stuff, treatment and how to cope.
Okay, first up, let's just tear down the myth. Before we can even get to the science, we have to understand what we think we know and why those common ideas are often, well, just plain wrong. And here it is, maybe the most important takeaway of this whole thing. No doctor, no psychologist, no one in a clinical setting is ever going to officially diagnose someone as a sociopath. Why? Because it's not a real medical term. It's basically slang for a very real condition, which is called Antisocial Personality Disorder, or ASPD for short.
But here's where it gets interesting. Those ideas you have in your head about a sociopath, someone who's super charming at first, who lies and manipulates, and who just doesn't seem to feel bad about any of it, that stuff isn't just made up from movies. Those behaviors are actually rooted in reality. They're the exact kinds of signs that point toward that real diagnosis, Antisocial Personality Disorder.
And that brings us to the other big point of confusion: sociopath, psychopath. You hear them used almost like they're the same thing. But are they? Let's unpack that.
So let's be super clear here. Just like the word sociopath, psychopath is not an official diagnosis either. A mental health professional doesn't diagnose either one. Both of these popular terms really fall under one single clinical umbrella: Antisocial Personality Disorder. Now, that said, if you look at the research, some experts do make an informal distinction between the two. Think of it this way. Sociopathy is often linked to nurture, a person's environment, like a rough childhood, leading to impulsive, hot-headed behavior. On the other hand, psychopathy is seen as being more about nature, something innate, biological, leading to cold, calculated actions and a total lack of empathy. But remember, this is a way for researchers to think about it. It's not what you'll find in the diagnostic manual.
Okay, so let's leave those informal labels in the dust and talk about the actual official diagnosis. We're going to look at what the DSM-5, that's kind of the official guidebook for mental health pros, says about antisocial personality disorder.
So, to diagnose ASPD, a clinician is looking for a long-term, consistent pattern of behavior. It's not just a one-time thing. We're talking about a history of ignoring rules and laws, of being dishonest for personal gain, of being impulsive and aggressive, and maybe the biggest one of all, a real lack of guilt or remorse for the things they do and the people they hurt.
And getting this diagnosis isn't a simple checklist. It's a pretty rigorous process. First off, the person has to be at least 18. They have to show at least 3 of those 7 signs we just talked about. And this is a huge one. There has to be proof that these kinds of behaviors started before they were 15. It's a condition called conduct disorder, which is kind of like a precursor to ASPD. And of course, they have to rule out other things like schizophrenia or bipolar disorder.
So that begs the question, right? Where does all of this come from? What actually causes someone to develop a condition like antisocial personality disorder?
It really comes down to that classic debate, nature versus nurture. Is someone just born this way? Or is it a result of what happened to them as they grew up? Well, when it comes to ASPD, the science is pretty clear that it's not just one or the other. It's complicated.
Really, it's a mix of both. On the nature side of things, we're talking about genetics, maybe even differences in brain structure that can make someone more predisposed. But then you have the nurture side. Things like childhood abuse, neglect, or growing up in a really unstable home can act like a trigger. It's usually that combination that leads to the disorder, and in some cases, it can even be acquired later in life from something like a traumatic brain injury. So, this brings us to our final and maybe most important section. What can you do about it? Is there a path forward for someone with ASPD and for the people who care about them?
The single biggest hurdle to treatment is that, a lot of the time, the person with ASPD just doesn't see a problem with their behavior. They might think they're perfectly fine, even charming. So why would they need to change? Because of that, a lot of them only end up in therapy because a court makes them or their family is putting on a ton of pressure.
But when someone is willing to try, there are options.
Things like cognitive behavioral therapy, or CBT, can help someone start to recognize and change their destructive ways of thinking. There's also mentalization-based therapy, which is all about helping them understand their own feelings and, crucially, the feelings of others. And while there's no magic pill for ASPD, some medications can help manage specific symptoms, like aggression or impulsivity.
So what if you're the one dealing with someone like this? Well, your first priority has to be you. That means setting really firm, really clear boundaries. It means being direct and explaining exactly how their actions are affecting you. And yeah, it means encouraging them to get professional help. But honestly, the most important thing might be getting support for yourself so you have the tools to cope.
And that leads us to the bottom line, and it is so, so important. Your safety, emotional, physical, all of it has to come first. If those boundaries keep getting crossed and the behavior doesn't change, creating some distance or even ending the relationship altogether might be the only healthy choice you have.
Which brings us right back to where we started, the words we use. Instead of just slapping a big scary label like sociopath on someone, the most powerful and helpful thing you can do is focus on the specific actions. It's not about making excuses for them, it's about being precise. It's way more useful to say, he was monitoring my social media, than just calling him a name.
So I'll just leave you with this to think about. What if we all made that shift? What if we moved away from the dramatic, often inaccurate labels and focused on understanding specific behaviors instead? Could that help us have a more accurate and maybe even a more helpful conversation about mental health? Thanks for tuning in.